My name's Debbie and I'm with Festivals and Events Ontario. Welcome to our Tuesday Talks with FEO, and our guest today is Janet Sellery. Janet, hello, welcome.
Thank you, Debbie. It's great to be back with the FEO gang.
Yay, I love chatting with you, Janet, and I'm looking forward to this particular chat because I think it's so relevant to what's happening to all of us today in this industry, in our industry. So before we start, Janet is with Sellery Health and Safety and has also started the Event Safety Alliance Canada in Stratford. Why don't you just give us a little bit of a background of who you are, and then we'll get going.
So lots of you know this already, that I'm originally a stage manager, and after a critical injury involving an actor, my career sort of trajectory changed, and I became very involved with health and safety as it applies to the arts, entertainment, and live events. I went back to school, I got some professional designations, and eventually I left the Stratford Festival after 24 seasons and began doing health and safety consulting, really specializing in these industries that I care so much about. But along the way, probably around 2012 or 13, I became aware of the Event Safety Alliance in the US and got involved with the work that they were doing. And subsequently, I've joined their board, and I've also been working to create Event Safety Alliance Canada with the goal of providing safety education to our very specialized creative and event industries. So that's something that we're continuing with. We had to, you know, as so many of you did, we had to cancel our event. We had a conference planned for March 31st. And, you know, so a lot of what you guys have been through, I've been through as well, but perhaps in a much smaller way. So I recognize that heartbreak and that challenge and sort of the work we need to do to sort of reopen and get things back on track. So that's me.
Thank you. Thanks for doing that. So event safety. I mean, there's just so much in that particular conversation. So we're 250 days into this pandemic. I can't believe it's 250 days. Shocking. So where are we at, Janet?
Well, so I have to say that back in March, I imagined that come November, I would be sort of wiping the sweat from my brow and thinking, wow, this is over. It's so great that events are back on. That was really tough, but here we are back to normal. And I think we can all agree we're really not back to normal. And in some ways, in many of our bigger cities, we're actually in a worse position. So I'm going to start off with the bad news first, and then we'll talk about the positives, because there are very many positives that we're finding during this time. So first of all of you are listening to the news. Perhaps you're measuring that out in small doses. You're wise if you do, but we know that the status of the pandemic is worsening. Our restrictions are increasing. And within Ontario, our gathering sizes are now ranging between 10 and 50 people, depending on where we are. So that's a big blow to the event world. We're also experiencing a whole lot of confusion. There's a lot of politics and a lot of public health guidance, and they don't seem always to be well aligned. We've got a conflict in some cases between the needs of business and the findings of science. It was very disheartening to see that, you know, originally in October, there was a restriction that came out in the Toronto area and some of the other big cities when they went back to the modified stage 2, that venues were completely shut down. So they couldn't even do the sort of pivots they had been doing to live streaming and rehearsals and workshops. There was some very sustained and intense advocacy that got that turned around in about a week, but still, it was a really disheartening time. So we've seen our most recent framework, the whole color-coded framework, was revised within a couple of weeks to bring the thresholds down to much more stringent levels as guided by public health expertise. So that level of confusion, it really can be hard to move forward because it's not always clear what we should be believing. And I think that's a big problem. There's a lot of experiments and studies and research that are going on. But again, we're not at the point where we can say a lot of this is definitive. We're seeing some things that are positive, hopeful, but as of yet, many of these studies are not peer reviewed. We can't be certain that journalists are necessarily interpreting some of these studies in a way that is really practical. And we have to look at ourselves personally. I know that within my network, there's a lot of pandemic fatigue right now. We've got certainly an escalation in mental health challenges. I put out a newsletter and I've sort of clung to 4 words, which I have clung to since the very beginning. And I say cope, help, work, learn. And I try each day to do a little bit of each one. But you know, there are days when coping is going to be all that many of us can get through. But we have opportunities to help other people to find work in new ways and to learn, sometimes about workish things and sometimes about just interest things, which is good. We're all really missing our families and our friends. And this is hard to look forward to the holidays, which will be quite different. And one of the areas that has been hopeful is the whole news about vaccines. There are some very promising vaccine candidates which are working their way through the approval process. And it's really hopeful that we'll see distribution starting in early 2021. But we know that initially these vaccines are going to be prioritized for vulnerable people and essential workers, such as people who work in healthcare. If we're really going to be looking at our big events, our mass gathering type events, we're going to need to see either widespread vaccination and or effective treatments. And realistically, in terms for the biggest events to happen, I estimate that's likely to be 12 to 18 months away. The challenges around vaccines include some distribution challenges and logistics. One of the promising vaccines requires ultra cold storage, which makes it, it means that not every doctor's office can put it in that little fridge they've got. There will be some requirements for more than 1 dose. And any vaccine that needs 2 doses, it can be difficult to make sure that everybody gets both of them. And we're seeing also more vaccine hesitancy. And by that, I'm not trying to call out anti-vaxxers. That's a sort of separate story. But some of the hesitation we're seeing is related to news stories where we've seen, there's been such a focus on vaccine development, more so than any other vaccine. So when a trial gets stopped because of an adverse effect, we hear about it. That's probably happened for every successful vaccine to be developed. But when we hear about it, it makes us nervous. And when we hear about politicians in other countries who are talking about sort of pushing past the regulators to get stuff out quickly, it can make us nervous that those vaccines are actually going to be safe. So I'm hopeful. I think our Canadian governments are working very, very hard to make sure that vaccines will be safe and available, but it's not going to be quite as quick. I see some people going, oh, vaccines, yay, gigantic events in May, hurrah. And I'm a little more cautious about that one. So those are the hard things. You know about them. You probably spend the occasional night looking at the ceiling, trying to get them out of your mind. And as an antidote to that, I want us to just take a moment to reflect on the positives, because we have an awful lot of people who are following public health advice. We have a tremendous number of people who are supporting each other in little ways, in big ways, in phone calls and texts and emails and check-ins. and donations and making things, it does make you happy to be part of the human race when you see those activities being carried out. And on the event side and the artistic side, we have never seen such a time of creativity and innovation. There is so much going on that we have as a community to be proud of. So that warms my heart. So that's a long way of saying this is where I think we are at 250 days into the pandemic. Anything you'd like to add, Debbie?
No, I kind of like what you said.
Okay, cool.
I do want to ask you one question though. You did say your 4 words are cope, help, work, and learn.
Yes.
What do you do to cope?
So cope. So personally, what I do is I try to keep to some routines. Not always. I sleep in on Sundays. I don't set an alarm. I know that's wildly crazy thing to do, but I typically get up at the same time. I get up about 7 or 7:30. I try to get to bed by 10:30 or 11. So I find a regular routine of sleep. I have a few things that I do to make myself feel like I'm having a normal day. I have a shower. I make my bed. I open the curtains. Some of these things you sort of go, I don't need to do that. I wash dishes. I do laundry. I know that one of the very best things I could do would be regular fitness. I aspire to that. I'm just going to leave it at that. I eat things I like as well as things that I should eat. But I stay in touch with friends and I stay in touch with colleagues and any person who calls me or emails and said, hey, can I talk to you for a little while about a thing I'm thinking about, whether that's a career change or a safety question. That's what, having purpose, having people that's how I cope. Family as well, talking, I'm one of 6 kids. We have a regular schedule since March where each of us calls our mother once a day, so we're not all hitting on her on one single day. I have Thursdays, and then we send a WhatsApp sort of proof of life message to the rest of the kids. So those are some of the things I do. And I'm open to new ones if everyone has great ideas.
Wonderful. So we've seen a lot of reopening guidance since the pandemic. Can you tell us about new resources?
And there are new resources. So here we are, further into this thing than we ever imagined. And the first one I'd like to just talk about is the Event Safety Alliance 6-month update. So the original reopening guide, which was crowdsourced, there were about 300 people involved with that. So they got a really wide view of submissions, of things that should be included. And so what they decided to do is they looked at it and felt that really as a resource, it's still really solid and that they weren't going to completely rewrite it. Their choice was to do this update. So since the original reopening guide was published, it has been downloaded over 30,000 times and translated into quite a number of different languages. So it's become kind of a basis where other guidance can grow. So this 6-month one was really an update to describe things have changed. And some of them are similar to things that I talked about as part of the status, but I'll just take you through some of this. So one thing that has been identified, so some people are really frustrated when things change. They think, oh my gosh, you were saying no masks, and then you're saying we should wear masks. That's a terrible thing. Everyone had it wrong. And the truth of it is that's how science works. You work off what you know to be true. And when you get new information, you have to change direction. So to some degree, this reopening guide is in recognition of what we know now that's different. So first of all, is the understanding now that the coronavirus is primarily transmitted through aerosolized droplets. So early on in the pandemic, and maybe you guys were doing this as well, but I was getting my groceries out of the bags and wiping down all the outsides of the packages. And I've eased off on that. I'm not doing that anymore. We used to quarantine our non-perishables in the garage for a few days. I'm not doing that anymore. What we understand is the whole disinfecting and sanitizing is less important now. It's not to say it's not important, and everyone is going to expect to see cleaning happening, and you must continue to do it. But it's really important from a gathering perspective to make sure there's good air circulation, physical distancing, and face coverings. We cannot replace those precautions with any amount of cleaning, okay? We also have a better understanding of risk factors and how they interact. There's some more information within this about artists and the need for, in some situations, physical barriers and specialized masks. So the Ontario legislation actually requires barriers depending on where you sit in the whole color scheme. They require a barrier between singers and musicians, particularly the wind and brass players, and the audience. So that is required essentially at all times up until we have red and gray. So red is our protect and gray is our lockdown. When we get to those levels, there is a requirement for physical barriers between certain musicians and singers. At that point, we can't have audiences, so the barrier between the audiences is not specifically required at that point. Specialized masks now exist for singers. So they're masks that almost have a frame inside them so that people can have more freedom to sing and get a deeper breath. And those have been developed in consultation with people who do singing, which is important. There are also some masks by which you can play wind and brass instruments. There are even some covers, which I was surprised to find. So you can put this sort of bag all the way around your clarinet or your saxophone to capture all of the air that comes out of that. There are bell covers that go on the end of certain instruments to filter the air. So those are some of the things that certainly were not developed in the early days. We've also seen new definition from the Centers for Disease Control and Prevention about close contact. So in the early days, close contact was really defined as being within 6 feet for a period of 15 minutes. Now what they've learned is that they're defining it now as being within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period. And that's relevant from 2 days before illness onset, or if there's someone asymptomatic 2 days before that specimen was collected, until the time the person's isolated. So that means we have to have greater concern for interactions that may happen over a period of time. Now, I don't think most of us are super reliant on saying, we are going to be unmasked and close to someone for up to 15 minutes. I don't think people have adopted that. But this is just recognizing that cumulative exposure is as dangerous as spending that continuous 15 minutes. Okay, so I'm going to turn my little page of notes over now. This ESA 6-month update also gives some information about different types of testing. So it's got just a little bit of info just so you can understand the difference between the initial testing, so the golf club up your nose, tickling your brain, versus the more rapid testing, which is becoming available but is not widespread in terms of available in Ontario as yet. That more rapid testing has different accuracy. It tends to be more accurate in identifying positives than negatives. So you could get a negative test and still potentially be positive. So, that affects whether we imagine we could invite 10,000 people to an event and do rapid testing, whether that's a reasonable option. We know more about temperature checks now. So that was something people were very quick to adopt, was I need to get a no contact thermometer and I'm going to test everybody. And that's happening. They did that at my dentist office during that happy 5 appointments in August when I had to have a root canal. I would put that down to not one of my silver lining moments. But we know now that up to 40% of people who are infected are either asymptomatic or pre-symptomatic. And what that means is that even if they're infected, they will not have a temperature that can be measured so that we can use that as a way to turn them away from our event. So the other challenges within that guide that they identify is the real difficulty of enforcing rules. I think here in Ontario, that's going better than some municipalities in the US. They are experiencing, as we are, the uncertainty about government regulations. So, federal versus provincial versus municipal. When we're getting different things from different people, it's problematic. And they've also spoken to the one big economic concern that we all have, and that's about having to pay out full overhead where we know we're going to have reduced capacity at events. And how is it possible to make that work? So I encourage you to go to the Event Safety Alliance website. It's a free download. They're still offering their reopening guide as a free download, and indeed the full event safety guide, which is pre-COVID, but it's a good resource and you can download it for free. All right, I'm going to move on to the next new piece of guidance, and this is called the #LightsOn Venue Reopening Guide. And this was launched last week on November 12th, maybe a week and a half, maybe 2 weeks ago, almost 2 weeks ago. And this is, I was involved with this committee as well. And what this one is about is really specific to Ontario, looking at indoor venues. And it's including information that affect both patrons and workers. It's got some really good information about the COVID-19 coordinator role, how you might consider implementing that. What we wanted to get at, so that the coordinator role has, we've seen different terms for it. Some organizations call it a COVID-19 compliance officer. We've also got the term infection mitigation coordinator. Various terms are floating around. We just called this one a COVID-19 coordinator. It's not a legislated requirement, but it is a good idea. And so there's some instruction there about how you could consider making that role work within your organization. And just more broadly, to give you kind of the scope of that document, was we were looking at venues that are hold up to about 3,000 people. So we weren't looking at the gigantic arenas and stadiums, but we were looking at venues of all sizes down to tiny. We wanted this information to be useful for non-venue based companies. So producing companies who might rent a venue, that they would have guidance available to help them. And so there's some good information on a variety of different topics. There's also some information about staff training, things like discussion about ventilation. And there's a series of resources as well. What makes this guide a little bit different from some of the others is that it's been set up as a web page, a series of web pages that can be easily updated. Because one of the challenges about a lot of these documents is they get set in stone, they're available as a PDF, and then as things change, it can be challenging to keep them up to date. So this one has taken a slightly different approach on that. And there is a page where you can see what the changes are. So if you go back to it, you can get an update from that. There's some resources attached, including, and this one, if you operate a venue, I would encourage you to have a look at this. Mervish Productions has worked with a number of medical consultants and created a reopening plan for their theaters. And they have generously shared this. So there's a link to it. You can look at it and see if there's any of that information you might want to adapt for your use. So you know, that's sort of the spirit of community that we're enjoying right now, that people aren't necessarily keeping their light under a bushel. They're sharing it so that we can see if there might be something we could include as well. There is a workshop tomorrow. I think it's also at 11 o'clock to talk more about the Lights On venue reopening guide, but I do encourage you to have a look. It's another free document. And then I've got two more I want to talk about more briefly, but just want to note them. The first one is another committee that I'm on, and if you found me hard to reach, maybe it's because I'm doing a lot of committee meetings. I'm part of the and now Ministry of Labor has now got a longer title. It's called the Ministry of Labor Training and Skills Development. And I'm part of the Advisory Committee on Health and Safety for Live Performance. And I've done that for, I don't know, more than 15 years probably. We've been working on guidance since probably about June. And initially it was based on the guidance that they fast-tracked for the film and television industry. So we took that guidance and then we've adapted it for live performance, and because there are some fundamental differences and some additional things we need to be concerned about. So where that one fits is that Ministry of Labor only has jurisdiction over workers, which can easily be expanded to, you can use all this information with your volunteers, but it means it doesn't include anything related to your patrons, your customers, your attendees. It has some very strong areas about facilities, so to look at different areas of the facility that may need to be considered. And it has a lot of departmental guidelines. So that's what that one figures out. So that one is pending. Yesterday, the final version was sort of buttoned down, and now it gets submitted to the ministry. And hopefully they will push that through as quickly as possible, because that's another piece of guidance. So what you may be sort of gleaning from all of this is that there is no one-stop shopping in terms of guidance. We always hope that there will be, but realistically, there are different areas of scope that each document will address. So I really encourage you to seek out, to really understand your own needs and then seek out the guidance that's going to be most helpful for the kind of event that you're doing. If you're doing an outdoor event, 100% first place to look is the Networking for Municipal Event Planners Municipal Return to Event Guide. It's got tons of excellent information. And that may not be the only guide you need, but that's going to take you a certain distance. If you're going to deal with something more specialized, I have a giant spreadsheet of a whole bunch of different things. If there's something you haven't been able to locate, shoot me an email. Glad to help you track it down. So that's a lot of talking. I'm going to throw it back to Debbie now. Well, I have a little rest.
So what I wanted to say here is that, your second word is help. And so I can see where you're helping during this pandemic. You've got your fingers in a lot of pots, as I'm sure everybody on this panel, the panel who are attending this, you have your fingers in a lot of pots. And I can see where you're helping the industry, trying to help us try to figure this all out generally.
Well, I hope so.
For that. Yeah, thanks for that. You were also, so there's also another, you said something else, a silver lining moment, where you said it wasn't one of your silver lining moments, but what can you say was a silver lining moment for you?
I would have to say one of the silver linings for me has been seeing how people are stepping up. So I get emails from people in all sorts of organizations with questions, and you can only get closer to solutions when you're asking the right questions. And when I talk to people about the questions they have, sometimes they're just calling me really as a reflector. They don't need new information from me. They just want to talk to someone who can say, I really think you're headed in the right direction with that. Here's another resource you might want to look at. this has more, you know, I've always had such tremendous admiration for event planners because of the kind of skills they have, the way that they can anticipate potential issues, the way that they can learn from one event as they jump into the next. And I'm really seeing that sort of magnified right now, that all the skills that event planners have, all the skills that people who production manage and technical, you know, do technical direction and operations and all of those, you know, pieces that go into this puzzle. I really think we're seeing people at the top of their games. And that is what is going to bring us out of this. Not as fast as we want, not in the financially viable way that we want initially, but we're, you know, and we're seeing people do smart things that focusing on things we never had time for, looking at equity, diversity, and inclusion, looking at mental health, looking at training. You know, there's a lot of people who are not just focused on COVID, but they're working on their health and safety programs. They're trying to figure out how they come back better and stronger. And I just have such, you know, for me, that's just such a tremendous silver lining. And I'm not saying I don't have bad days. You know, I've probably spent far too many hours in front of the TV. I've probably spent far too many moments with my hand in the cookie jar. But I am seeing such good in all of this. And everybody on the call, like, I know that you are all doing these things. If nobody told you yet today that you're doing an amazing job with what has been thrown at you, I want you to just take this as this moment of Janet's telling you, you're doing a great job. You're doing what needs to get done. And we're going to get there.
I agree. And I love, excuse me, it is so rewarding to be doing these Tuesday talks and have all these participants, all our industry show up and hear what our guests have to say and taking it to the next level. So it's, yeah, thank you. Debbie says you're doing a good job.
And Debbie's doing a great job too. You know, and I extend that to individuals, but also to organizations. We have seen organizations, you know, arts service organizations, industry associations, really, really, really fighting for their members, listening to their members, advocating for their members. You know, if you were always just sending off your membership and wondering, you know, what am I actually paying for? I think so many people are getting clarity on the kind of, you know, value that these organizations are providing. It's cool.
Agreed. I know Dave's got his head buried on calls all the time for our industry, and we really, really do appreciate it.
Yes.
Okay, one other question right at this point. What suggestions do you have for learning more about event safety?
All right. So lots of people are jumping in on lots of webinars. There's many, many of them that are free. So, you know, I've been knocking off as many as I can squeeze in. One more pitch on the Event Safety Summit, which you can register through the Event Safety Alliance website. It's a flat registration fee, all online, 5 days of content. There will be at least 30 sessions, and many of them, the way they're going to be devised is there'll be a 45-minute recorded piece followed by live Q&A. So that's to kind of get some of the glitchiness of the online experience out of the way for the presentations, but still to have that opportunity for interaction. When you register, you get all of that content for 30 days. And if you're a member, that content is available to you for a year. So I've got 3 sessions. I'm involved with a panel, and there will be, I'm doing a discussion with a presenter about volunteers. And then on the final day, I'm doing a COVID response planning workshop, which will be a live session. And yeah, and we'll have a really great time. It's a great group of people. There's a lot of webinars out there available, and I'm just going to give you a few of my top picks. And what I can do with Debbie is if you want, Debbie, I could send these links to you afterwards.
That would be great.
I could give you just a little handout.
Yeah.
But I'll just tell you a little bit about the ones that I think are important. One of them is the World Health Organization has a COVID-19 mass gatherings risk assessment training. And these are all free, by the way, with the exception of one that I will note. So on the World Health Organization website, you can register for that. I haven't completed it. It's not long. It's maybe, there's two. The one I'm doing is about a 30-minute one. I'm seeing something come in from Rebecca, but I will look at the chat anon. So that one's a good one. I think they also have another that is like a 4 to 6 hour more intense course. So that's one I recommend. If you're involved in performing arts, the National Collaborating Center for Environmental Health, located in British Columbia, did a session in late September, which was about COVID-19 risks and precautions for performing arts. And that was really excellent. There's a Public Services Health and Safety Association has one called The Role of Ventilation as a Control for COVID-19 Transmission in the Workplace. So if you're an indoor venue, that one might be of interest. And Act Safe in British Columbia. So Act Safe, you may have heard me talk about before. It's Canada's only dedicated safe work association for film and television, performing arts, and live events. They have a free online 30-minute COVID-19 safety procedures course, which I encourage you to look at. And then the other one I want to just mention is Safe Sets International. Now, it's really for the film and TV industry, but they do have a free module, which is their level A, and then they have a more detailed one called level B, which is, I think, $45. So if there's something specific you're looking for, though, let me know. The beauty of it is all of these organizations that are doing webinars are recording them and they're making them available. So so there's lots of stuff. So that's the stuff I wanted to tell you. And that's not bad for timing. We still got some questions.
Not bad at all.
I'm just going to peek in the chat.
Yeah, and feel free. So now, thank you for all that information. It was wonderful information, really informative. I'd love anyone who may want to ask Janet questions, feel free to unmute yourself or raise your hand, and we will, you can ask your question, and we'll go, and Janet, if you want to go through the chat.
Yeah, maybe I'll start with going through the chat. I'm going to want to save this classical stretch on PBS. I'm going to want to find that. That sounds like just what I need. Safety credits on a Netflix movie. I'm going to have to look more closely at that. Last night I watched, does anyone watch Chicago Med? It's one of my, okay, I have to admit, I really like the fire one better, but so I watched Chicago Med, and their first episodes were in COVID times. And they've obviously recorded it, some months ago, but it was interesting to see all of a sudden in this fictional TV setting, we're seeing, the screening, and although they had a weird thing, they had them walk through this little booth where it sprayed disinfectant on them, which I was like, that is so dubious. I'm sorry. The infection's on the inside. It's coming out when you breathe. But anyway, and thanks, Kyle, for the note about the COVID safety team on film and TV. That's why film and TV has been able to start up, is they have this massive, massive program. It involves regular testing, lots of oversight, and there's some really terrific resources for film and television. I pause in that I don't think testing is going to be a realistic intervention for most events and performing arts applications. It's extremely costly, which if you don't have to worry about having audiences and you can spend all your money on getting a perfect take, that may be totally reasonable. If you're looking to have an event that runs over a weekend with 1,000 people, it's not necessarily scalable, but we have a lot to learn with film and television because they are back at it. And I can make sure that the summit link gets posted. Yes, I will do that. Yeah. Oh, I'm glad to see there's a few people who've already done the WHO risk assessment one. And Rebecca, you've done the bigger one, the longer course. Do you want to just tell us a little bit about what you felt about that? Did you find it relevant? Was it useful?
Sure. Yeah. Thank you. Hi, Janet. Hi, everyone. I highly recommend both of the courses. I did the public health course, the longer of the two, when it first came out several months ago. It is advertised on the WHO website to take between 4 and 6 hours. Didn't take me that long. I would expect it probably won't take any of you that long, so don't consider it particularly daunting. It's COVID focused, but also very generically public health applicable. So in my experience, planning large scale outdoor events, pre-COVID public health, only pertained to food vendors, alcohol, and like, do you have enough washrooms? It really did not address keeping people healthy at your event, which is certainly an outcome of COVID, but not exclusive to COVID. This course does a really good job of capturing those responsibilities and making you think critically about public health as a mechanism of general safety. So I really highly recommend that course. And then, yes, I did just 2 days ago complete the risk assessment for mass gatherings. It's advertised to take an hour. It took me almost 2 because the content is very rich. And they provide a bunch of different downloadable Excel spreadsheets, and then the quizzes that you undertake in each of the chapters of the module refer to those downloadable Excel spreadsheets. So in my opinion, if you really want to get the most out of the course, do the Excel spreadsheets as you're doing the quizzes. It takes you a bit longer than they expect it to take, but it's really worthwhile. Really, really, really good content.
And great to get good content for free too. Like that's one of the things that I felt was it's so much more accessible. Yeah, so anyway, I encourage you to we're in a point where sometimes, when suddenly gathering sizes go down to 10 people, what can you do? Well, these are some things you can do, and you can add them to your resume and you can add them to your planning process. So I think that's really, really valuable. I wanted to speak to the question from Susan. Hello, Susan. Happy Meaford, about the plexiglass barrier. So we have a really, really unusual situation in Ontario because our provincial government has made this a requirement that we have to have a barrier between singers and musicians who play wind and brass instruments and spectators. It is not negotiable. We are not able to replace that with extended physical distancing, even though I know, as you've said, there is the possibility in many, many places to have more than 12 feet available. So we have to comply with that. However, I have been doing some research about it, and I have some good information from I spoke about a presentation with the National Collaborating Center for Environmental Health. So I contacted the presenter, Dr. Juliette O'Keefe, and I gave her all the information I had about barriers and asked her if she would respond to that, which she did. Because our provincial government has given us nothing in terms of size, alternatives, flexibility. I took the information she gave and I have submitted it to City of Toronto, the events team there, who are in contact with Toronto Public Health. It is an issue that I can continue to research and to try and engage people to talk about. I did hope that we would see some flexibility on that. With the worsening of the pandemic, I don't think we're going to see any of that in the short term. Is that any help, Susan?
Yeah, thank you, Janet. Thank you, Janet. This has really been my bugbear for the last few months, especially when things were improving as we went into the fall. But I realize the timing of this question right now is probably not appropriate given the province of Ontario. But at the same time, in the future, I mean, the barriers I just wondered if there was any flexibility.
I know. And I'll let you in on a little secret. I actually went to a show on Friday night. I know this sounds bananas, but our son had found that there was a performance of Ron Sexsmith, who lives in Stratford now, and he did a performance at the Revival House, which is used to be the church restaurant. So it's a giant space. And we had not eaten inside at a restaurant since March, nor had we gone to a show except for outside. So this was a fairly big deal for us. We bought the ticket, he reserved the tickets a couple of months ago. And so on the stage, they had a screen that was, I would say 2 feet, there was it was sort of like on a stand of 2 feet above the ground. And then it was at least a further 5 feet high and about 10 feet wide. And it was framed like a really nice picture frame. And it was really, really clean. And I didn't have any problem seeing the show that way. He came out with his mask on, he got behind the screen and took his mask off and sang, and we were able to forget about that. I probably looked like the nerdiest person in the place because a lot of his songs were sort of ballads and they were quite dark. And I was just smiling away because I was in a room hearing live music after a fantastic meal. So yeah, I recognize the challenge of the barriers. And I would love to come back to you with news. That one is, if you're doing advocacy, that is definitely one where I would just like to see flexibility. I am all for making sure that artists are safe, that audiences are safe, but where we do have the ability to, not sell 2 rows of seats or, whatever it takes, I would love to see that as a possibility. So I'm going to jump back to the, I'm looking back into the, so we talked a bit about barriers. Oh, COVID plots. Oh, so there are more shows. Yeah, cool. There's more shows on TV that are doing COVID-based plots. I'm going to have to look at those. And Kyle has a question about large gatherings based on the study over the summer. Are you looking to the German study?
Yeah, that's exactly what I wanted to ask about.
Right. Okay. You know what? I'm going to just pull up some info that I have, so I'm not talking off my head. So that was a really important study. For those of you who aren't familiar, let me just open my file. Bear with me. Debbie, you can chat a moment. You can, okay. If you'd like to fill for a moment.
Okay. So Kyle, why don't you fill in a little bit about what you know of the study so that Janet can hear some of the questions while she's looking?
Well, yeah, I don't want to give inaccurate information, but in Germany, they ran a simulation of a concert. So they actually had, I believe, like between 4,200 and 5,000 participants come. Everyone stayed 5 feet apart. And while they didn't have drinking and certain things, they had a live performer run through 3 different types of scenarios. They had people, I believe, using like some type of UV thing on their hands so that they could see different contact points and where people contact. They used fog machines. and then just so that they could look at the viability and safety of running a concert with these protocols. And to my understanding, even though it wasn't exactly the way that a concert may have actually run, it did seem to provide a positive result towards the viability of running a concert or live event in COVID times. And I see Janet is nodding her head.
She's nodding away.
Yes.
Yeah, so that was a really important study because what it did, now they did want to have 4,000 people. What they actually got was about 1,500. And I'm just turning to one of the articles I have about it, because of course the press release was translated from German to English. So I'm just going to tell you a little bit. This is based on an article. So there were 3 parts to the study. The first one was this live concert, and it was on August 22nd. They had 1,500 participants, and their goal was to try and evaluate the level of exposure with through direct contact with other people in the venue. And that's why they had this sort of glowing sanitizer, so they could measure some of that. They also did a computer simulation of airflow to estimate the level of exposure through aerosols. And that's what they used the fog for, so that they could actually see the movement of the air. And then they did an epidemic model, which they created based on the data from the first 2. So they had this concert, and one thing to note is that every single person was tested before they went in. So that was a big piece of it. They had hoped to do a pre-corona scenario where they would have maximum capacity. They were hoping for, that venue could have taken 8,000 people. So their pre-corona scenario was no social distancing, but including PPE, and that they would use 2 entrances, 2 catering stations, and unrestricted washroom access. Then they looked at moderate hygiene measures where and again, they didn't get the full number of people they wanted, but they were going to fill at 50% capacity, alternating every seat empty or full, like a kind of chessboard pattern. And then so with that one, they split the venue into quadrants. So they had dedicated entrances and food services. And they closed every second urinal in the washrooms. So they were distancing people more. And the final one was limited seating. This is where they would use only 1,500 people, distancing them about 5 feet apart, so 1.5 meters. And they used 8 entrances to the venue, again, with the dedicated catering and washrooms. The artist was a German artist, Tim Benzico. They were trying to get realistic behavior, and they were also looking at the simulation of arrivals and departures by tram. So their contact tracer, so they had a little bit of, I'm not sure exactly what the device was, but they had a contact tracer that would assess how close people got to each other. They had masks, which were they met a different standard, but they were similar to the N95s. And the fluorescent hand sanitizer would identify everything they touched, so that they could understand more about where would they focus their cleaning. So again, they hoped to get 4,000. They got 1,500 volunteers. Yeah, so the data was a little bit different in the first 2 scenarios because they wanted more people. But they did try to extrapolate that information, which may or may not be useful information. They did a computer simulation where they looked at aerosols. So what's really cool about it is the findings. So they found that the registration and check-in are the most critical moments. So lining up is problematic. So people need to look at staggering entry times and how they load the venue. And they found that they could increase the number of gates so that they had about 250 people entering per hour. They got some good information about hygiene measures that they work. So that was really good to know that mask wearing must be enforced throughout the event. Food and drinks had to be consumed while seated, so there was no new contact, and that they would employ, they were calling them hygiene stewards, to maintain hygiene and make sure people stuck to the rules. And that they would ask people who did not comply to leave. So that's important. There needs to be a reevaluation of networking in food and beverage, because there is a risk when people take their masks off to eat, drink, and mingle. You know, the key component was to make sure people understood they have to stay seated where they're assigned. So standing, not a good idea. You know, so all of those kind of general admission events, really problematic. Ventilation, poor ventilation increases the risk. So they got some good information about ventilation. This particular article that I'm looking at, one of the things that I found important about it was it asks whether these results are reliable. And they were very well satisfied with the people that attended were very disciplined, and they, you know, wore the mask, used the disinfectants. But we need to be cautioned about whether that's likely behavior. So the question here was how many people are going to respect the rules once they have freedom to, you know, comply or not comply. The modeling for the first two scenarios was based on the smaller group, which, you know, results have not been peer reviewed. So it's hard to say whether that can be reasonably accepted. That doesn't have the same rigor as the sort of science-based recommendations that they've made. So in summary, combining strict hygiene measures, updated ventilation, and dedicated physically distant seating with testing at the door seems to be the only scenario that really minimizes the risk of contagion. Employing hygiene stewards should be the norm. Mask wearing and distancing should be enforced at all times. Standing in groups should be avoided at all costs. So, and then they sort of give the hope that more research will continue to give more of a framework. So it's mixed, right? It's they learned a lot. I know that the UK is planning to do some more experiments along these lines. But I've seen some headlines about that study for it's like large events are low risk. You go, not yet, not quite. But definitely it's good information, and we you know, take the positives to make them happen.
Yeah, well, so one thing I'm curious about is now going in towards the next year. Like right now, I've been a part of a variety of different formats of like from drive-through Santa Claus parades, and I'm actively working on film sets. So like I was COVID tested 4 times last week, sometimes twice a single day, because I have to be tested for every single production.
And you can't take your test results with you.
No, they want their own production.
Okay.
Testing. So it's an extra scheduling thing. But right now I'm having conversations with some of my festivals that I normally work with every year, and they're trying to work towards next year and what the guidance is coming from municipalities. So I'm wondering what you think the information from this study and what we may be heading into next year. Like I'll be talking about some of these things in a couple of weeks as well, just from things that I've seen from my perspective. Mm-hmm. But I'm wondering what insights you might have, and in knowing that we will need to be resilient and responsive as.
I know. And the bigger the event, the longer the timeline for actually putting it together.
Yeah, exactly.
And that's like, you know, you can't just pull this out of a hat on 2 weeks notice. Debbie, I think you should get Kyle on to do a discussion.
Kyle's our last speaker of our series for
I wasn't looking beyond mine. Yay, I'll have to sign up.
Yeah.
Okay, so you want me to give this is like a guess. My guess is that we will be looking at maximum outdoor group sizes of 100 people for some time. My hope is that by spring, that number may be, you know, escalated to some degree, but it's still going to be very buttoned down, I think, over the next, like until next September at least. maybe 2022. So I would say anyone who's planning a big event should also be planning a small event and be ready to pivot. I'm not sure. I mean, I would really want to say, go for it. Do everything like you did 2 years ago, but I'm just not feeling it right now.
Right.
Debbie?
Right. Yeah. Dave, did you have anything? I see you've unmuted yourself. So that's usually a
Yeah, thanks very much, Janet. You've been a very big help to us and all of our stuff that we're getting out to our members as well. 2 points I just wanted to get your thoughts on. And while I agree with your 12 to 18 months, I hope we're both wrong. And
I hope so.
I hope come summer, I don't think we're going to be at the levels we were at what we would call normal, but I'm hoping that towards summer and into the summer, some of those thresholds get to the point where they're at least viable to do something rather than sitting back and doing nothing or smaller scale. But I also wanted to get, for some of us veterans on the line who have been through SARS and swine flu and now COVID, it's just a matter of time until something else is going to come along and throw a wrench in there. So how do we make sure as we move forward that this pandemic plan may not fit exactly the next pandemic, but at least we're starting to have that pandemic mindset? And
that's a really important point, Dave, because so I started a health and safety full-time job in a theater, Stratford Festival, in 1999. And my job was health and safety coordinator. But most of my work was around safety, really looking at the high-risk hazards, electricity and working at heights and all those kinds of things. Health really didn't come into my view until SARS in 2003. And I had to very, very quickly start doing info briefings for the leadership on, I don't know anything about public health at that point. So I do think it's important that we look to a lot of these precautions and go, these are going to be permanent. Many of them will be permanent in terms of keeping alive the infrastructure for health screening and cleaning and PPE, and that we should look to the future as we may be going in and out of this. But I think we will have some degree of restriction probably for the next 5 years. We may be up to big gathering sizes, but, it is not going to be uncommon to see people in masks over the next 5 years. Maybe not 100%, we may not need that, but we need to lock in some of these changes that we're doing. For a while I was thinking, why would you even bother making a safety plan? This thing is going to be over. Why do we even need a COVID-19 plan? Well, what we need is a COVID-19 plan now for every single organization. And then we need to be able to edit it for the next, whatever the next infectious disease is that comes along.
And you sort of answered my second question off the back of that, in that what elements of the COVID planning and do you think will stick around? I agree with the cleaning, and I would guess some sort of better contact tracing moving forward, whether that affects, group buying of tickets. Do you need a name for every ticket and address, or what else do you think will stick around through that, what we've learned now?
Yeah, I think for one thing, people need to have a budget for PPE and supplies that they may not have had a line item for in the past. That people need to look at spaces in a totally different way. It's going to be a really long time before anyone feels comfortable stuffed tight in a lineup. General admission events, I think they're off the table for a good long time. I think we may have more luck in getting larger events, but those will be either fixed seats, circles on the grass, platforms on the grass. There will be something that we will need to use to keep households separate for some time to come. I think the contact information, I heard some people talking about that as a silver lining, that by getting, you know, a name and an email for every person who attends, now they have a point of contact from a marketing perspective. So, you know, there may be some value in some of those things, but I definitely think every organization should be prepared to do that. Yeah.
Thank you.
Thanks, Janet. So thank you everyone for joining us. Thank you, Janet, for sharing your wisdom and your knowledge and just being here for us in our industry. We really, really do appreciate it. Just a quick reminder that next week we have Susan Patterson, who's going to be talking something different for us, the ABCs of reading a room. So knowing how, when you're meeting people, how to try to identify who they are from a personality perspective, and better communicate with them. We have Daryl Sherman from Canada's LGBTQ Chamber of Commerce the week after, and then we have Kyle coming on board talking about partnering in innovation. So, and that Kyle will close our season, and then we'll open up again in January, in mid-January, with the Tuesday talks, and hopefully with some other things in February that we're still working on. So with that, I want to thank everybody for joining us. Thank you, Janet. Thank you, everyone who asked your questions, and have a safe week, and we will talk to you soon.
Thank you, Debbie. Bye.